Turmeric is a yellow spice used for centuries in food and traditional medicine. Today it is also one of the most studied natural health compounds in science. The main active compound in turmeric is curcumin. Curcumin affects inflammation, oxidative stress, and cell signaling in the body. Most proven benefits come from curcumin extracts, not small kitchen amounts. Let us start with where turmeric has the strongest human clinical evidence. The strongest and most consistent evidence is for osteoarthritis and joint pain. Multiple randomized controlled trials show curcumin reduces knee pain, stiffness, and improves movement. Several studies show effects similar to common pain medicines with fewer stomach side effects. Turmeric also has strong evidence for reducing chronic inflammation. Studies show reductions in inflammatory markers like CRP, TNF-alpha, and interleukin-6. This supports benefits in low-grade inflammation and metabolic conditions. For digestive health, evidence is moderate. Turmeric helps functional indigestion, bloating, and mild gut inflammation. For ulcerative colitis, it may help maintain remission, but it is not a cure. For metabolic health, evidence is modest. Small improvements are seen in blood sugar, HbA1c, and LDL cholesterol. Turmeric supports treatment but does not replace medication or lifestyle changes. For brain health and depression, evidence is emerging. Some small studies show benefit, but results are not yet conclusive. Now let us talk about dosage. Most meta-analyses show benefits at 500 to 1500 mg per day of standardized curcumin extract. The most common effective dose for joint pain is about 1000 to 1200 mg daily. These doses are usually split into 2 or 3 servings. Whole turmeric powder contains only 2 to 5% curcumin. 1 teaspoon of turmeric powder provides roughly 150 to 200 mg of curcumin. To reach clinical doses, you would need 5 to 7 teaspoons daily plus absorption support. This is why supplements are used in research. Now let us compare different forms of turmeric. Raw or fresh turmeric contains volatile oils and enzymes, but curcumin absorption is very poor. Turmeric powder is stable and convenient but has diluted curcumin and fewer volatile compounds. Cooked turmeric releases curcumin better and absorbs better with fat, but heat destroys some sensitive compounds. Aged turmeric extract has stable antioxidants and less stomach irritation, but usually lower curcumin and fewer large trials. No form is perfect. Each form gains something and loses something. Bioavailability is critical. Curcumin is poorly absorbed on its own. Black pepper increases absorption up to 20 times. Dietary fat improves absorption because curcumin is fat-soluble. Phospholipid liposomal and nano formulations also improve delivery. Turmeric works best with other nutrients. Helpful combinations include black pepper, olive oil, coconut oil, ginger, omega-3 fatty acids, and quercetin. Now let us address common overstated claims. Turmeric does not cure cancer. Evidence is limited to cells and animals, not human cures. Turmeric does not detox the liver in a clinical sense. More turmeric is not always better, and high doses increase risk. Important drug interactions must be considered. Turmeric can interact with blood thinners, diabetes drugs, chemotherapy agents, and acid-reducing medications. This is especially important at supplement doses. Side effects are usually mild but include stomach upset, nausea, and increased bleeding risk. People who should use caution include pregnant or breastfeeding women, people with gallstones, those on anticoagulants, and anyone preparing for surgery. Finally, how do you choose a good turmeric supplement? Look for standardized curcuminoid content, clear dosage per capsule, absorption enhancers, third-party testing, and minimal fillers. Avoid products that hide amounts behind vague blends. Final takeaway. Turmeric is not magic. But it is one of the best-studied natural anti-inflammatory compounds. When dose, form, and absorption are correct, it offers real measurable benefits. Evidence matters more than hype.